elbow hyperextension taping is going to be for the radial or ulnar collateral ligaments of the elbow, and this is usually going to be from hyperextension, where a wrestler, gymnast, or any athlete falls on their arm and their elbow goes past normal ranges of motion, spraining these ligaments. So we want to tape them to prevent them from getting to that same point so we don't get any further injury. Start with pre-wrap, about mid-forearm, tracing all the way up to mid-upper arm, just like so. We're going to put anchor strips around the bicep, and that's important because this will be too tight of a tape job if we don't have the athlete flex. So in the position that we want them in, which is right here, I want the athlete to contract his bicep, so squeeze, and he's going to hold that while I put on my anchor strips. It's important to make sure that your athlete does not relax while you're taping, because if they relax, then you're going to put the tape on tighter than desired, which will decrease blood flow, and then the tape job will have to be cut off and then reapplied. Now 3 anchor strips is usually going to be enough. We're going to put on a 4th to give us a wider base for a tape. Okay? And the athlete can relax their bicep. Sometimes you will get the pre-wrap to roll as the athlete moves their arm up and down into flexion and extension. Next, to contract the forearm, we have the athlete hold in a closed fist position and then flex the wrist. The girth or the size of the forearm will increase. Angle your tape, okay, the downward angle towards the thinner part of the forearm so that you don't get any wrinkling. Put you down like so. So the angle is downward, overlapping the tape. Kind of see a crisscross pattern starting to develop. 3 on the bottom is looking good. All right, so I have the athlete get into the position we want, which is right here. We're going to take our elastic tape. You can use white tape to do this as well. It's just going to be more rigid and it's not going to give as much room. This is going to be more flexible, okay, allowing for more motion. If we have an athlete we do not want to move their elbow at all, similar to the wrist, we can fully flex them and then tape them in this position. Or to give them a more functional movement, we give them with a little bit more extension in the elbow. Measure your tape to the desired length. Remember that elastic tape is always going to stretch. My suggestion is, come over here, is to lay your tape on the table after you've measured it. Find the arm, double check as to the length that you want. And then you're going to make a small X. With your elastic tape. On the table. When you pull it off on the piece of tape that you put down first. That way they all come off as a unit together. Back to your patient. Apply it to the upper arm, smoothing it out. And we'll do our closing strips. Flexing again. Angle your tape around. Just put one on first because we get where we want it. Have them flex the elbow. Oh, actually bend the arm, good. And we pull the tape toward the desired area where we want it. Smooth it out. So now I can have the athlete extend a little bit. Tape's anchored down here and then extend a little more. Good, so we know the tape job's doing what we want. Close it. Flex the forearm, which he's doing, nice and tight. Put the tape marks, the closing strips on tight, so it's going to hold your elastic tape down. Ideally, you want to tape this right to the skin. So your last strip should be right to the skin because it's going to prevent it from moving on you. And arm up. Same thing, angle your tape around here when you come up so it doesn't wrinkle. Closing strip like so. And again, last one should be right on the skin. Okay, go ahead and extend. So he's almost able to get this full extension, but we're preventing him from being able to go to full extension and hyperextension, so he's still able to use it. When we're done with this, we want to close the whole thing with stretchy elastic tape, just so that nobody gets their fingers caught in here or the tape job becomes loose during athletic competition. So we trace all the way up. And then we would close with closing strips to make sure it's not too tight. This is the elbow hyperextension tape job.